encourage future therapists to work through this, both professionally and personally. I mean, I know that has to take personal growth to be able to move forward.
Right.
I think that as a therapist in training, people feel like they get stuck or they don't really know how to help more efficiently.
Right.
What would you suggest?
And again, I think the field of family therapy 30 years ago started very creatively with live supervision and always having early trainees being able to watch what senior clinicians did. We've lost some of that. Now, we still do that at our center. Every trainee that comes in goes through the same process that the clients go through. So they're raising critical consciousness, and they're moving along so that if there's any, sort of trigger points, they're able to move and expand. And also be able to sort of shape their identity so that they're not just now clinicians, but they're community activists as well. And I should just say the field of family therapy, again, 30 years ago, was open and did think about community activism and actually critiqued all of those individual models. But we've kind of gone back to that system with managed care, and as you're saying, we've sort of used each model, each school's identified with a particular model rather than being able to teach a lot of models or teach a social justice model and borrow from all the other therapies as sort of micro interventions,
Yeah.
I mean, you can use structural family therapy, but it's a micro intervention, it's not a macro model.
Right, I've been struggling with that too, just trying to, well, that doesn't, there's pieces from everything that seems to make sense, but there are also pieces within each theory that don't make sense to me at all.
Right.
And how do you, because then there's this, you have to pick a model and then, but you don't entirely agree with it.
Right.
So it's a struggle.
Right. And all those models, were critiqued with the feminist writings in the 80s.
Yes.
So it's sort of weird that we've gotten back to them.
Do you think that, in life sometimes it's like one step back, two steps forward?
Sort of,
Do you kind of feel like maybe we went back and now we're going to push forward?
Right, and I think, the field of therapy is not different than any other field. We were in the shadow of very conservative times. Yeah. So I think it's natural that we sort of we're reflecting that. So I'm hopeful that we're moving into a different era.
And I think to be reflective is actually to take what's important from what was done in the past, because we can't ignore those therapies for what they've done for the field. I mean, we can take those pieces.
Right.
That's good that we take the 2 steps back to take the step forward, because then we're bringing with us some of the past. It needs to be, we can't turn a blind eye to it and act like it didn't exist.
Absolutely.
So I think that's really important. What do you think about, what are your thoughts on, we touched on it yesterday, white therapists, and trying to do social activism, and there seems to be this struggle with white therapists in terms of how they need to own their white privilege, but also be effective in activism.
Right.
So what are your thoughts on that? Because that seems to...
So, I mean, again, I think that the training programs don't deal with white privilege sufficiently. Like, we have a whole bunch of readings and conferences and social action that our white therapists have to go to. They have to go to that or they can't work at our center. And so you're in a community of other white people who are dealing with alone, you're not isolated. And so it makes it easier to then think about social action. Like one of the comments yesterday about addressing white privilege was to give a person a person of color, the possibility of being on a panel. Well, to me, that's not good enough. You have to have a policy. If you have a policy that says, every public conference I'm invited to, I will make sure that there are at least 2 people of color on the panel. If they're not, I won't participate. It has to be that kind of a position, not I'll have one opportunity to throw a coin to.
Right.
So I think that people have to do their work, and the White Privilege Conference that we go to that was started by Eddie Moore, who's an educator, is a phenomenal place to be at, because he was brilliant. 10 years ago he decided he wanted nothing to do with cultural competency. And funders wouldn't give him money because he called it white privilege. He's had hate mail because people have thought it's white supremacy. But he's done a tremendous job of bringing educators together and all disciplines. to be able to dismantle white privilege and to actually have tools and action so that you have something to work with, and it's not just cognitive process. Right.
Yeah, I think it's important to take it out of talking
Yes,
and doing.
yeah, exactly.
And put it in
Exactly.
doing.
Right.
Great, thank you for answering that for me.
Thank you.